So now we're going to go into our next session, which is focused on policy process and rights-based advocacy, right? So at this time, it's my pleasure to introduce to you Mr. Pierre Cook Jr. He is a youth technical advisor with the Healthy Caribbean Coalition, and his past professor, Mrs. Nicole Foster, who is the Deputy Dean and Head of Law and Health Research Unit at the University of West Indies in Cave Hill, Barbados. They'll be chatting, they'll be having a chat about this topic that they are so passionate about. And I will invite you all, if you're able to just grab a cup of coffee, a cup of tea, your favorite drink, as long as it's healthy, less sugar, less fat, and just listening. Welcome, Nicole and Pierre.
Hi, thank you. Can you hear me?
Loud and clear.
Thank you, Rosanna. So it's a pleasure to be here. It's a pleasure always to interact with Pierre. So what we were asked to do was to reflect a little bit about human rights advocacy and its importance. And so we decided to do it. So there's not a formal presentation. We're just going to have a bit of a wrapping session, a conversation about these issues. And so I thought to start off in terms of orienting the discussion, I could maybe start off with a sort of definition. Lawyers, we always like to be very clear about what it is we're talking about. And so what is rights-based advocacy? And so as Cassandra actually was averting to in her presentation just now, it's really just advocacy that is very much grounded and oriented in terms of the content and language of human rights. And so the idea is that you would be making specific reference to these obligations, these commitments that member states have made, and relating that back then to your particular policy ask or your particular issue that you're advocating on. So it can be quite a powerful tool and quite a useful tool. And maybe, Pierre, you can pick up from here and say why for you as a youth advocate, we know you're very active in this space, why for you think rights-based advocacy is the way to go, as opposed to maybe a more formalistic or just a health-based something just very technical based on the medicine of the situation.
Thank you. And I actually think Cassandra did a brilliant job of kind of pointing out the value of rights-based advocacy. And the thing is, when you look at human rights and the system of human rights, it's necessarily a frame or body of I guess things that everyone is entitled to. So you don't necessarily have to apply for human rights. You don't have to apply to your governments to have access to them. You don't have to qualify for them. You don't have to say, well, I have a disability, so I should have access to these rights, or I'm in a middle-income country, so I should have access to them. Regardless of where you stand in society, just by dint of being a human being, you have access to these rights. And now the value of that is necessarily the legal obligations that governments have. So Cassandra kind of explained that a bit earlier, which makes my job a bit easier, kind of going through, the role that governments play in ensuring that everyone has access to those rights. Now, advocacy that is based on a human rights-based approach necessarily is saying to governments, well, hey, I have a right to health. It is your responsibility to ensure that I have access to the highest attainable standard of healthcare. So I am basically reminding you of your legal responsibility to me to ensure that I have access to these things. So you're not telling governments, well, we're asking for this because we really want it, or, it would be nice to have this. Necessarily, you're saying that I have a right to this. So it is your responsibility to ensure that we have access to it. So you understand that that is a stronger type of advocacy. I have seen necessarily in the way I have advocated in moving from just a health base and, it's a decent thing to do into a space of it is a person's human right. There's that stronger legal responsibility that governments must understand. You have to ensure that your citizens, and especially those who are the most vulnerable, and again, that is something that human rights ensures, that the most vulnerable are protected. Women, girls, children, persons with disabilities. Human rights ensure that you are not taken advantage of because you may be in more vulnerable situations. So I think that again highlights the importance of it. And I think Ms. Foster can then tell us how this has been important in terms of advocating for healthy food policy. There are many examples across the region.
Yeah, just before that appeared, there was some stuff that you mentioned just now just sort of resonated with me, and I just wanted to maybe emphasize it a bit more. And it is the power of moving from the moral to the legal.
Yes.
Right. So much of the discussion prior to introducing a discussion about rights-based approaches to NCD prevention and control is very much one of persuasion, right? Of moral, oh, this is the right or good thing to do. But then when you move into legal space, as Cassandra was very powerfully illustrating, it is a different ballgame, right? We're at a different level. Another important dimension as well, I think, is that it moves, because much of the discussion at the level of the moral very much orients around the individual.
Yes.
And the powerful thing about human rights is, of course, that they're directed towards governments. And so in that space, and of course now with COVID and everything else, we're having all those debates about where does the individual come and where does the government come and what's the appropriate balance. And what human rights really powerfully advocates for or establishes is that separate and apart from whatever responsibilities there may be at the individual level, and of course there are those obligations. Stacia, for example, was speaking about, you know, the choices we make when what we put in our kids' lunch box, and you know, the choices, Cassandra talking about the choices we make when we have the little bit of spending money and, you know, the tax job or whatever it is. So there's absolutely a space for the individual, and rights-based advocacy does not detract from that. But what it does is add another player into the space and make it clear that these things can't be done by individuals alone, and that there are obligations, because by definition, human rights are obligations directed towards governments. Yeah. And so it means then that we have a basis on which to say to governments, you know, to add that extra player. And I think that is so important, because that also helps reinforce and strengthen the move away from the moral over to the legal. And really helping you understand that, you know, this is a different, we're engaging at a different level. Yeah. But in terms of, just to pick up, to answer your question, which is where it is that we're at in terms of utilizing, where concretely we can see the human rights-based approach to advocacy being utilized beneficially. And certainly, and Cassandra once again just did it. She would have spoken, one of the policy asks is, of course, front of pack warning labels. And what HCC Youth, UNICEF, other partners of the HCC, UNICEF, OECS Commission and others have been able to do very effectively is to leverage that space of human rights to sort of create whole campaigns. And so in the context of front of pack warning labels, it's not just about this will help you better make choices. It's about you have a right to know what's in your food. So the Heart and Stroke Heart Foundation in Jamaica, for example, their whole campaign, their tagline was, you know, what's in our food, you know, we have a right to know. And that can really resonate with people, but also help them understand the complexity of the issue, that it's not just about, you know, them providing some information to you, but in fact that this is a obligation a formal legal obligation that they have to you. And so, as I said, in the different iterations of that front of pack warning labels campaigns that have been running throughout the region for a while now, we've really been able to build from that basis of rights. And we've seen even been able to use things like Cassandra mentioned, the Special Rapporteur on Human Rights articulation of how FOPL fits within that scheme. And that gives you a much stronger argument. It's much more difficult then for governments to say, oh no, but there are other choices, or oh no, you know, we want to go another route. But obviously, as you said, it's not just front of pack warning labels. Perhaps most impactfully has been the work in the school nutrition space. So you can maybe speak about that.
Yeah, and I think it's important when thinking about the school nutrition policy to understand the elements of rights that are in there. So first, you have, children have access or necessarily have a right to health, a right to the highest attainable standard of healthcare. So that immediately places a responsibility on governments to ensure that children have access to this, proper health system. Beyond that, you have the right to information, which informs the front of package warning label system. And again, it informs the nutrition policy because children must understand, parents must understand what is in the foods that we're offering to their children. Beyond that, children have a right to be protected from predatory marketing within their school environment. So you should be able, or children should be able, to go to school and just have a regular education without being bombarded with these marketing tactics from fast food corporations. So all those elements of human rights, children's rights specifically, were promoted in order for us to have what we have today as a school nutrition policy. And in Jamaica, it's already taken off and it's going pretty well. And in Barbados, we're about to launch our school nutrition policy. And basically what it says, and basically what it is that the ministries of education and government have necessarily understood, and they're moving towards fulfilling their obligation to respect, protect, and fulfill a child's right to health, to be protected from predatory marketing, and also their right to information. And so you see in that space that by relying on these children's rights, we have moved into a place where governments have said, you know what, well, we're listening to your advocacy, we've heard it, we understand that it's our responsibility, and this is our answer to that. And that necessarily will lead us to a space where we see within our school environments, at least, children have a healthier system. And so human rights, again, allows us to move away from, blaming the individual or putting the responsibility solely on the individual. And when you look at the broader system of healthcare, you understand that there are various social determinants of health. And so it's not enough to say, well, the child should exercise some more, or the parent should take the only responsibility for ensuring the child has access to a proper, healthy childhood. But necessarily there's a responsibility, a legal responsibility on governments through this rights system to ensure that children are protected. And so you see the layers of it, all those different rights being promoted so that we end up with that school nutrition policy. And that's just another example in conjunction with the front of package warning label system.
Absolutely. So maybe at this point, we can just turn it over. I believe our time is up. And so we'll turn it over to the audience for any questions or comments you may have.
I see Angel has her hand.
Angel, please go ahead. I assume you can just unmute yourself and speak. So please go right ahead. No, Angel? Maybe we're having a challenge there. I saw the hand is now gone. Any other questions or comments from anyone?
Someone unmuted.
Angel, if you wanted to speak, you're actually still muted. Yes, I see Jan, about Shannon, I think it is, if I recall the name correctly, but the Jan rap. You can go right ahead, please.
Right, thank you for your very insightful discussion. I think one of the challenges that most advocates probably have when we're thinking about rights-based advocacy is this idea of balancing rights, and how do we make sure that we don't infringe on anyone's rights to the benefit of any other one person or any one group. And I find, especially in Jamaica, having been doing human rights advocacy for quite a while, we have very interesting sentiments about human rights, especially from the government side and from the how the general public may even perceive civil society groups and human rights based groups. So I'm just wondering if there are any tips you can perhaps share as to how we can counteract that sort of dissonance where persons are just like, oh, these human rights based groups, these advocates, they always come in and they want something. And what about all these other things that are happening? Because the reality is, this is just one of many issues that are affecting young people. And, we are very passionate about wanting to make sure that young people have access to healthy foods and that there are policies in place to promote that. But what about all the other things? And persons who may say that, what about all the other things? Why aren't you focusing on that or giving that sort of passion? So just kind of like any insight about the balancing of competing priorities and thinking about how we look at rights-based advocacy as not just a one issue focus sort of thing, but ensuring that we give different issues equal. Yeah, you get what I'm saying.
Yeah. Sure. I'll go very quickly and then I would let Pierre close it out in terms of his ideas. What I would say is a few things. Firstly is, I think that it's important to recognize that rights are indivisible and interconnected. And so there's not a sense in which in addressing, and that's something that you have to emphasize to persons, that yes, our focus right now may be on health or on the right to information, but in the context of what we're trying to accomplish with the front of pack warning labels or the school nutrition policy, whatever it is, but recognize that this has implications for other things as well. It has implications for your child's education, because we know that healthy children learn better.
Yep.
And so in that context, it's not that we are one issue people, we're actually holistic people, because that is the type of approach that human rights necessarily demands. Yes. The other quick comment that I would make is more from a more technical point of view, and that is in terms of this idea of infringing on others' rights and where does one strike the balance. And unfortunately, there's no I can't give you a 1, 2, 3. When you hit this point, it means that you've gone over what is allowed in the context of the accommodation that can be made in this human rights space. But what I will say is that there's a lot of flexibility there. So yes, we have rights and others have rights, but the sense is that, the public interest, and in the health space in particular, that's a powerful sort of counterbalance, right? That there's a public interest that has to be secured in the context of human rights. And so no rights are absolute, and consequently, yes, your right to A, B, or C, or D may be infringed. So one of the discussions we've had is with front of pack warning labels, that might infringe in principle on the face of it, a company's right to commercial speech. But is it really a violation of their right? No, it isn't, because when we look at issues of proportionality and reasonableness, we can justify those outcomes. And I think we have to bear those things in mind. And there's a lot of education too to be done. We know, in Jamaica, I think y'all are a little bit further down the road than maybe we are in Barbados. So as you said, y'all have been advocating for quite some while in this human rights space. But I think it's very much, we're at the beginning of this journey in terms of persons understanding what human rights are, understanding their implications, understanding that this is not an attack on them or an attack on their rights as parents, etc. So we're in an evolving space, and we have to continue as we advocate to educate. Pierre, over to you, and you can close it.
I think one of the signs that a lecturer or professor has done their job well is when the student has the same train of thought, and necessarily that's where I was going. And again, I thought immediately to the front of package warning labeling space, where industry may say, we have rights as corporations, as a legal person, to market our foods, and we have rights to be able to distribute our foods. There are trade laws that says, you can't restrict how much of this we can import or what we can import. But again, that balancing act of protecting the public interest. So the public has this right to health. The public necessarily must be protected. And again, you must balance that against industry's rights. So you're allowed to market your foods. You're allowed to put them out into society. But we are saying that for the public's interest, we want you to just say, this food is high in fat, this food is high in salt. Or even if you're going into the schools, you're not supposed to, market to the or prey on those vulnerabilities of children. And so you see again that we come to that space of, kind of balancing out the private interest against the public interest. Again, I'm not going to reiterate the points that Ms. Foster made, because that's exactly where my mind was going. I think we have one more question. I don't know if we can squeeze that in. By Alex. Alex has a question.
Alex, maybe quickly, I'm not seeing anybody tell us we can.
Yeah, I didn't see him.
I was checking the group to see if anybody said put on your hand, Alex. But just a quick question. In terms of as a health advocate, as a medical professional, I don't have that type of how can I say, that type of expertise as my law professionals would have. And I don't want to be a lawyer, I have no interest in that area, but is it that
Wow.
and how is it that we can foster some partnership with our personnel who has these techniques and skills and training, and be able to put it with our medical training to put forward better policies and health advocacies and stuff like that? So, not to attack anybody, but that's my
That's fine.
train of
That's
thought.
fine.
Yes.
That's absolutely fine. Ms. Foster, do you want to go? You said something, man, but you go ahead.
That's a really good question, Alex. And I think there are a number of levels to it, right? So the first thing is that it's important for you all in this space, and HCC has been doing a great job of it. Jan has been doing a great job of it. To recognize that we need whole of society's responses and cross-sectoral responses. So as we construct our coalitions, to really consciously try to reach out and involve others who are non-medical. Yeah, that's one. The other is that we're slowly but surely trying to build some capacity in this space as well. And that capacity is targeted not just at lawyers, but also at those in the medical profession. So for example, I'm going to do a little promo now, right? So the Law and Health Research Unit at the Cave Hill Law Faculty, which I head, in October, we're launching a second cohort of our Introduction to Global Health Law course. And then that will be followed by our Introduction to Law and NCDs course the following semester. And we did a very impactful one last time. That's why we're doing it again, right? Because we were oversubscribed. And the idea is that it's targeted at lawyers, but it's not exclusive to lawyers. So we actually had quite a few public health people and medical professionals. I have people from the Mona campus, medicine, who have already reached out and are registering, etc. So I can certainly share with Danielle that. And another outlet that we have is we've created a Caribbean Public Health Law Forum, which I actually now am chair of the steering committee of that. Pierre also participates in it. And that was really an attempt to try to create a space, a virtual space at this time, but we'll try to meet face-to-face sometimes. But that was an attempt to fill that void, to create a space where we bring together medical, health and law persons, and give them a common space to talk and exchange views and develop positions. And so I can equally share with Danielle in terms of HCC youth, maybe we can put some information out there about the forum as well, in case anyone's interested. And Pierre,
that again, that's exactly, I was going to do my promo for the Caribbean Public Health Law Forum, and again for the Law and Health Research Unit at Cave Hill. But I think, Alex, another point to note is that civil society organizations are playing a part in educating the public at large. So both medical professionals, we've engaged persons outside of the medical field. And even if you look at Healthy Caribbean Youth, you'd find that we don't only have health advocates or persons in the health sphere, but we have persons outside of that element. So legal professionals, persons who are involved in civil engineering, because we understand, again, that we need this whole of society approach in order to ensure that everyone is involved and each person or each one reaches one. Again, tomorrow, I'll go through and point out the Healthy Caribbean Coalition has developed a childhood obesity prevention rights-based agenda. And that necessarily is a tool that helps youth advocates to see how you can advocate for the prevention of childhood obesity based on a human rights approach. So there are different tools that the Healthy Caribbean Coalition puts out there. There are different seminars and sessions that are put together, as well as the Law and Health Research Unit. And I implore you to check both that out and the Caribbean Public Health Law Forum, which is doing excellent work in terms of collaborating between health and legal professionals to promote improved public health across the region. Yeah.
And I think that's it, Madam Chair. I think we're out of time.